Hello and welcome. My name is Tim Gravel. I'm a family nurse practitioner student at Auburn University, and today I'm going to be telling you about a serotonin 2C receptor agonist. The serotonin 2C receptor agonist only has one current drug in its class, and that is lorcaserin. There are two trade names, Belviq and Belviq XR, which is the extended release version of that drug. The mechanism of action, or the pharmacodynamics for this drug, is that it increases satiety by activating 5-HT2C receptors located on the anorexigenic neurons in the hypothalamus. The therapeutic effect of this drug is that it decreases appetite with subsequent weight loss and health benefits. This medication is well absorbed through oral administration. After oral administration, it's easily absorbed, and then it enters into cerebrospinal fluid and into the central nervous system. The medication is then metabolized by the liver and excreted mainly in the urine, with 2.3% excreted in feces. There are several precautions when administering this medication to patients. One is priapism. This medication has an adverse reaction of causing priapism, so please be aware of administering this medication in patients that are males with sickle cell trait or have a history of priapism. Another caution is in patients that have heart failure or bradycardia. Anyone with suicidal ideation or behavior should not be administered this medication either because of the serotogenic effects. There are also precautions for type 2 diabetics, as this medication may cause hypoglycemia. You should also practice caution in patients with moderate renal impairment or severe liver impairment. Use extreme caution in patients that are on serotonergic drugs or any antidopaminergic agents. This medication is contraindicated in the pediatric population, in people that have severe renal impairment or end-stage renal disease, in pregnancy due to the weight loss potentially causing fetal harm, and it should not be given to mothers that are breastfeeding. Adverse reactions include neuroleptic malignant syndrome, serotonin syndrome, priapism, valvulopathy, bradycardia, hypertension, and hypoglycemia. Due to the fact that this is a serotonin drug, it has interactions with other serotonergic agents, including SSRIs, NRIs, MAOIs, and TCAs. Indications for prescribing this drug are for chronic weight management. It's prescribed to patients that have a body mass index of 30 or higher. There is stipulations where you can prescribe it to a population that has less than a 30 BMI, and that's if they have other comorbid conditions such as type 2 diabetes, hypertension, or hyperlipidemia. In these populations, you are able to administer to patients with 27 or higher BMI. This is a drug choice that you would use in patients that are obese, where weight loss would either help to prevent comorbid conditions or help to improve comorbid conditions. While patients are prescribed this medication, it's important to monitor weight loss. If they do not lose 5% of their initial body weight within 12 weeks, you should discontinue the medication. It is also important for diabetic patients to monitor their blood sugar frequently to prevent hypoglycemic episodes. Education for patients would include checking their finger stick frequently if they're diabetic, and they also need to be aware that this is part of a weight loss plan and that diet and exercise should also be practiced. There are going to be four main takeaways for the serotonin 2C receptor agonists. To demonstrate these, I'm going to be drawing on a dry erase board, and give me just a moment to readjust the camera and I'll give you those takeaways. Okay, so four main takeaways. These are all going to have to do with the number 30. The first, remember when prescribing, BMI has to be greater than or equal to 30. Unless, number 2, they have any of these three comorbid conditions: hypertension, type 2 diabetes, or hyperlipidemia. 1, 2, 3. If they have any of these three comorbid conditions, you can prescribe if they have a BMI of 27 or greater. Third takeaway, draw another 30. We turn that sideways, draw a little face with some hair, some arms coming out, holding a pregnant belly. Remember, do not prescribe to the pregnant population because the decrease in appetite can cause fetal harm. And the fourth and final takeaway, the number 30 again. It's good to remind patients that it can take up to 30 days before this medication becomes effective. Well, I hope you learned something interesting about serotonin 2C receptor agonists today. Thank you for watching. Again, I'm Tim Gravel, family nurse practitioner student, Auburn University.